population. So I did not take into account the other two factors. Do we know how to differentiate between PAHs inhaled versus PAHs ingested? No. Because once they go into the body, the metabolism that they take is the same. And what we can do is measure them in the urine or in the blood, but that will be the sum of all the PAHs that we were exposed to rather than just one source of exposure. What we're doing now with the Faculty of Medicine is working on assessing the levels of PAHs in the urine of people who were admitted in the hospital having cardiovascular problem. So this is an ongoing study because we believe that the onset of cardiovascular diseases in Lebanon and in the region, that is 12 years earlier than what it is in the rest of the world. And this is alarming. And that's why a lot of colleagues from the medical field are now extremely interested in understanding the effect of air pollution on cardiovascular diseases and on pulmonary diseases as well. So this is ongoing as we speak, and I should be able to share with you some of the results probably in the near future.
Great. Thank you. We can push to 5 or 7 more minutes. I have Josette and then Naila and then Webke. Anyone else would like to? Okay, so we have these three.
Thank you, Doctor, for your engagement. I will try to be brief. I have only one question, technical question in relation with your comparison of LA, Los Angeles, to Beirut in terms of number of cars. Whether you took into consideration not only the legislation present in LA, but also the surface, the area, the magnitude of the area compared to Beirut or to Lebanon, because it's bigger, and whether this has an impact. The other thing is that when you did this simulation over Beirut, and there was some areas where there is a peak in those carcinogenic, whether the presence of high building or agglomeration of building in this area without the ventilation, if you can say, impacts this as well. And third, which is for me as a physician, I focus on it a lot, and I repeat it always during my consultation, but now I would like to say it publicly, that why we focus much on water pipe, smoking, etc., because unfortunately we have no control as individual on air pollution, and we have no control on generator or whatsoever, on the 3 factors that you mentioned at the beginning. But we have control on the only reversible risk factor, which is smoking. And it's 100% in our hands. And that's why we push people to not only not to smoke, but to avoid sitting in areas where others are smoking. Because if one water pipe, if you sit close to a water pipe for 2 cigarettes, in the public area, especially in closed areas, you are smoking 2 plus 2 plus 2 plus 2, almost more than a box of cigarettes. By confining yourself inside. And this is why we emphasize on the smoking, the closed area. And the last message before having the answers is regarding the Ajame cigarette. In fact, Ajame is better than the Masa, because everything which is sweet now, there's a study on the candles with smell, they are very carcinogenic. Because you have those sweet aromas added in it, and that's why the masal is more dangerous than the ajami. And the ajami, if you put it in water, hot water, and then use it, is much better. The Sindian fahm, I mean the charcoal, is much better than the others, because everything which burns quickly, there are diesel or any petrol products added, so it will burn quickly. And we need to avoid as much as possible whenever we have. And definitely the electronic cigarettes are carcinogenic as well. Yes. There are now more and more small studies, but showing that they can be harmful. So regarding LA.
So regarding LA, we just wanted to take a city that is similar to Beirut. LA is very, very similar. Of course, it's much bigger, but it's very similar to Beirut in that they have mountains surrounding the coast. And the point was not at all to do a complete comparison. We just wanted to see whether somebody living or having a store next to a traffic sign would be exposed to the same particles. So it was just an assessment of how much regulation is actually helping in controlling the toxicity of these particles. In terms of this map of Beirut that I showed for particle distribution, this is part of a much bigger project where we wanted to determine the hotspots meaning the accumulation of pollution, either due to the confinement from the buildings or due to lack of ventilation. We're studying this along with people from architecture and graphic design to see if we can also play with the type of buildings, how to design streets, where to put the diesel generators on the rooftop or on the street level. So all of these are being studied. In terms of, I'm just going to be quick, in terms of Ajami versus Ma'asal, the reason why we studied Ma'asal is that because it's loaded with sugar, and then whenever you have sugar, you have emission of aldehydes. One of the aldehydes is formaldehyde, and formaldehyde is known to be carcinogen. And because the youth in Lebanon and elsewhere are more interested in smoking Ma'asal, so that's why we did not study the Ajami. There is no such thing as Ajami better or worse. They're all going to use charcoal, and charcoal are a major source of PAHs. So I wouldn't even say that this one is better than the other one. For the electronic cigarettes, I will not say much because it's a totally different debate and questions, and we're definitely leading the whole world in our studies on electronic cigarettes.
Happy Eid, everyone, and thank you for a very inspiring and learned lecture, and which gave us much insights. I'm from the statistics division. We're working on transport statistics, and we are trying to do some pilot project on road safety. And I want to commend the way you made your research, and I don't know how you managed to get the data on transport specifically. And if you can brief us on that, I'd be very happy. And maybe we talk later after the session. I'd be very happy if you can share information. Unfortunately, lots of data and information is missing in our part of the world. And I'd like also to commend the collaboration that took place between you and other departments at AUB. I think maybe we can copy that at ESCWA, how different departments can work together. And I have one question also regarding, you mentioned two questions. You mentioned that when the pH, it can phase out with heat. You mentioned that but maybe you mentioned that it's more dangerous, it becomes more dangerous, so can you please explain? And that's a measure of cutting down on using these generators and cars, or improving the cars on the dates of their expiry and use. Will it help, or we're stuck with what we have as accumulation? Does it accumulate? Does it have an accumulative effect to this? And one more thing I'd like to ask is, maybe I lost the idea. So it's okay.
In terms of data, I think I owe it to, we as the group at AUB, we owe it to the Minister of Environment, especially the UNDP and the air quality groups, who shared with us the data that they have on registered cars.
Yeah,
so
but
they
the flow of transport. I'm referring to the flow of transport.
No, for the number of cars and the age of the cars. So we got the data on registered cars. And then we also went to bank reports and registries that were published to get how many import and export and how many registered versus non-registered we have in Lebanon. And we had to clean the data a lot because, for example, you would see a BMW running on a hybrid car in 1960. This is how the data would show, which is impossible. But we had to clean it up, and we had a very good student who wrote an algorithm who would check the year of the car, the date, the make, the model, the engine type, and everything, so that we can rely on good data. So it was originally given or shared from the Ministry of Environment, but we had to do a long cleanup before we can give the numbers that we gave. On the flow of cars, I don't know. I don't have a number of data, but what I did in the past, we had a van that was donated by RIMCO and Bank Audi, and we traveled from AUB to Jouni on daily basis to count the particles on the street as we go when we're stuck in traffic, and this paper is published. So you can see the particle count as you go on daily basis for a whole year. As far as the PAHs, when they react, they give you nitro PAHs. That means you get NO2 stuck on the benzene rings, and this makes it more dangerous. And this is,
can we get rid of it, or we're stuck with it?
that's what Dr. Tariq also asked, and that is they travel, then they become very stable, and they travel for a long distances, and they become harmful in the environment, not only for us, but also for. The question is, are we stuck? No, there is hope, and we can clean our city. Our other cities in the world have, faced similar problems, and now they are clean. We are lucky because the air, if you have some wind, you always see how Beirut is cleared up. The problem in the summer that we have stagnant wind. And stagnant wind means we live in a pressure cook. That means all the pollutants that we emit today, they will be continuously cooking until tomorrow and after tomorrow, until rain or wind comes in to actually clean it up. So our location is good. We just need to stop emitting pollutants.
May I add one more question? How can you attribute what the emissions coming from engines or from traffic? How do you separate which is coming from which?
You can't.
But when you say 38% and...
we had to do some math to actually subtract the background and then subtract the traffic contribution and do the levels when the generators are off. There was like too many parameters that we had to take on. Now for the factorization matrix, a statistical analysis that we did in order to know how much of each one is contributing. This is based on markers. So for PAHs, there are 16 of them. So we take some markers for gasoline, some markers for diesel, and then we can follow their contribution. Yes?
Thank you. Webcam.
Thank you very much for the presentation. I think my colleague alerted to a similar question. What I learned at the very beginning, that it seems it's healthier to live in Beirut in the summer than in the winter, according to the PHAs. But then you said something very alarming. What my colleague alerted to is that only because the PHAs go down, it doesn't mean that the air overall gets better, because the new connections that the PHA takes are much more toxic. So my question would be, in your research going forward, when you look at the entirety of air pollution, you looked at a very specific PHA that you said is very cancerous, yeah, that's the word. Are there any others? How did you pick that one? Is it a very highly likely one? And then given that this is just a fraction of the whole picture, when can we expect the whole picture on the real air pollution in the city? Thank you.
No, probably I didn't. Okay, sorry. Probably I didn't show the whole picture. The whole picture, we established the whole picture back in 2008 and 2007. So we measured the levels of particles in the air for a whole year, an annual average. And what we found is that the level of particles is 3 times higher what WHO recommends. So this was established in 2010 based on our calculations and our measurements. And then the question was, okay, we have particles like every other city in the world, they have particles, but how toxic the particle is, this is when we started looking at the chemical composition of these particles, and this is when we picked PAHs as one example. But the levels of particles were measured since 2004, 2005, for every year since 2004. So we had reported, over and over again the levels of particles, and nothing changes. Now I feel with the haze and with the smog, not especially after this article, I mean everybody is seeing this, I think it's time to reassess also the levels of particles in general and their toxicity. So this is what I'm preparing my lab to do. Now we're back on the field again to measure the particles, because what we measured in 2010 might not be true today.
Dr. Najat, I'd like to thank you once again for bringing this subject close to our daily life. And when we speak here, for example, about climate change, people in 2000, in the 2100, we will not live till then. There will be 1 degree increase in temperature. What does it mean? It doesn't. Here, you've really put it in a context of our daily lives, and with the scientific rigor. And so I'd like to thank you again for that. I know that my colleagues would be very keen to have. I will share usually Alexia, you share the presentation.